Medical news from JAMA Cardiology. Effect of Acoramidis on heart failure-related health status, a secondary analysis of the ATTR CM randomized clinical trial. Acoramidis markedly improved heart failure health status in patients with transthyretin amyloid cardiomyopathy, ATTR CM, delivering an average 10-point gain on the Kansas City Cardiomyopathy Questionnaire overall summary score, KCCQ OS, after 30 months of therapy, a change that exceeds the minimal clinically important difference and translates into a higher likelihood of patients feeling alive and not worse, alive and well, or even alive and better. This patient-centered benefit complements the drug's previously demonstrated mortality and hospitalization reductions, suggesting that Acoramidis can meaningfully reshape the disease trajectory for a population that historically faces inexorable functional decline. ATTR CM, an infiltrative cardiomyopathy driven by misfolded transthyretin deposits, disproportionately affects older adults and carries a grim prognosis, with median survival measured in years and a substantial symptom burden that impairs daily activities. Although tafamidis and other stabilizers have shown survival advantages, data on how these agents influence patients' perceived health status have been sparse, leaving clinicians without a full picture of the trade-offs between longevity and quality of life. The ATTR CM trial therefore set out to fill this gap by rigorously evaluating the impact of near-complete transthyretin stabilization on patient-reported outcomes. The investigation was a Phase 3, multicenter, international, double-blind, placebo-controlled randomized trial conducted from April 2019 to May 2023. Adults with confirmed ATTR CM were randomized 2:1 to receive acoramidis hydrochloride 800 mg twice daily or matching placebo for up to 30 months. Of the 632 participants enrolled, 611 comprised the modified intention-to-treat cohort, 409 on acoramidis, 202 on placebo, with a mean age of 77 years and a predominance of male patients, almost equals 90%. Baseline KCCQ OS scores were comparable between groups, 71.7 plus or minus 19.4 versus 70.5 plus or minus 20.7. The primary patient-reported outcome was a pre-specified secondary endpoint, the least squares mean, LSM, difference in KCCQ OS over the study period, analyzed via a mixed effects model for repeated measures. Post-hoc categorical analyses at month 30 classified participants as alive and not worse, less than or equal to 5-point decline, alive and well, score greater than 60 with 10-point decline, or alive and better, greater than or equal to 5-point increase. At the 30-month mark, acoramidis produced a statistically significant and clinically meaningful improvement in health status, with an LSM difference of 9.9 points, 95% CI 6.013.9, p less than 0.001, favoring the active arm. In absolute terms, 47% of acoramidis recipients, 171/367, were alive and not worse compared with 30% of placebo patients, 56-188, yielding an odds ratio of 2.1, 95% CI 1.43.1, and a number needed to treat, NNT, of 6. Similarly, 46% of treated participants met the alive and well criterion versus 31% of controls, or 1.9, 95% CI 1.32.8, NNT 7, and 25% achieved alive and better compared with 14% on placebo, or 2.1, 95% CI 1.33.4, NNT 9. These odds ratios indicate that patients receiving acoramidis were roughly twice as likely to experience a meaningful preservation or improvement in functional status. Subgroup examinations revealed consistent benefits across age brackets, disease severity, as measured by baseline KCCQ OS, and ATTR subtypes, wild type versus hereditary, reinforcing the robustness of the effect. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.